Hey, everybody, welcome to the live stream. We are so excited. It is National Speech Language Hearing Month, and we've got two great guests to speak with us, two of our speech language pathologists talking. We're all in the same room, so you're going to kind of see us looking around at each other. They're taking a break from working with their patients. We've got Trisha Martinez. She is a speech language pathologist here. Trisha, how long have you been at Mary Free Bed, and what part of the hospital do you work in?
I have been at Mary Free Bed for about 6 years, actually 6 years in June. I work in inpatient rehab and I work on the spinal cord injury unit with mostly with adult patients.
Another member of our team that's working here with us is Cara Ramirez. She is a speech language pathologist. How long have you been part of the team, and where do you work?
Yeah, I've been here at Mary Free Bed's main hospital in Grand Rapids for about a year. I work on the med complex team. But prior to transitioning to the main hospital here, I actually worked for Mary Free Bed up at Munson Healthcare in Gaylord, Michigan.
Awesome. So we are bringing two different kind of areas within the hospital that you guys are working and covering. And so we can really learn about speech language pathology and how it helps our patients. Trisha, just for people who might not fully understand what speech language pathology is, how would you define your work as a speech language pathologist?
I think as a speech language pathologist, specifically in the rehab setting, our goal is to always increase independence for our patients. That includes working on things such as communication, speaking, voicing, swallowing, and cognitive skills. I also like to think in the rehab setting, a lot of what we do is help restore a person's sense of self and kind of help bring back pieces of themselves and pieces of normalcy back into their lives after their injury. So people get these injuries, they go through these medical complexities, and their life kind of changes drastically in a moment. And a lot of what we do, even if it's helping them communicate with loved ones, voice their wants and needs, or eat and drink their favorite food again, that's giving them back their sense of self and their sense of normalcy. So specifically in the rehab setting, I think that's a lot of what we do day to day.
And especially like your work as spinal cord injuries, like it tends to really, be involved. Like, what are the types of spinal cord injuries that you're working with the patients?
Most patients with a cervical spine injury, so like C1 through C7, will require some sort of intervention from a speech language pathologist. That's because at that level, our spinal cord innervates functions that contribute to our voicing, our speaking, our swallowing, or breath support for speaking and for swallowing. Also, any traumatic spinal cord injury, so anything that involves like a head trauma or a brain injury, will also require speech language pathology intervention when they come here for rehab.
And Cara, you work on the med complex team. Like, what are some of the diagnoses that you see the most?
Yeah, great question. So it's pretty diverse on med complex team. So we could see things such as post lung and heart transplant patients, maybe head and neck cancer patients, patients with brain tumor oncology. Recently, we've started admitting patients with LVADs, and then we often see patients with trachs and vents.
What are some of the biggest challenges that you're working on with these patients?
Yeah, this is where it's kind of deceiving as our title of speech language pathologist, especially in my realm and a lot of my colleagues' realm, it's not always so depicting of what we do. We actually, a large portion of what we work on is like cognition. So things like memory, attention, thought processing. And quite often I work with patients with swallowing difficulties or something we call dysphagia.
Okay, and then Trisha, like beyond like communication, how are you working on like breathing difficulties with patients?
Yeah, so high cervical spinal cord injuries are most commonly seen by speech language pathologists, and a high cervical injury also comes with affecting the function of the diaphragm. Diaphragm's a muscle under your lungs, and it helps you breathe in and out. That muscle helps provide the crucial support for respiratory strength for speaking, for swallowing, and for coughing. So speech language pathologists will work with our spinal cord patients on respiratory muscle strength training. We do that in a variety of ways using traditional exercises, using breathing devices that have a resistance level built into them, using teaching techniques and compensatory strategies for cough assistance and things like that. All of those things, respiratory muscle strength training, all works together to help our patients improve their cough strength. That's crucial for our patients to be able to clear their airway of mucus, of any food or liquid, to help prevent any aspiration or any pulmonary disease after they have compromising injury. Also, it helps with just swallowing and creating a safe and efficient swallow if we have good respiratory strength. And then also most obvious to see with patients is their ability to voice and turn on your voice and communicate. You need to have enough air in your lungs to be able to project your voice, to communicate in a room. And a lot of our patients with spinal cord injuries have very soft voices because of that diaphragm being impaired from their spinal cord injury at the cervical level. So those are kind of those important ways in which we work on breathing, which you would think of a speech therapist, right? We work on breathing, but it's a big part of what I do in spinal cord rehab is that respiratory muscle strength training.
Yeah, and it's just so interesting, like the way that you collaborate with other parts of the hospital and the other
Yeah,
teams as well. Um,
absolutely. We work a lot with respiratory, like side by side with them too, with our trach patients, with our ventilator patients, to work on kind of strengthening and meeting our goals as a team with respiratory and speech therapy.
and you mentioned, Trisha, swallowing, Cara, like that can be a big concern after an illness. Like, what are some of the issues that some patients have with that, and how do you help them overcome that?
Yeah. As you mentioned, dysphagia is a disorder in swallowing and that we can see following many, many different diagnoses. Like Trisha mentioned, spinal cord injuries, strokes, traumatic brain injuries, multiple intubations. So what we do is we kind of work to identify the cause of swallowing difficulties. And then after doing so, we utilize exercises, diet modification, as well as like compensatory strategies to assist patients in at least perhaps when they get here, their NPO is that's the term we use for meaning they aren't currently taking food or liquids or medications by mouth. So we kind of try to get them on a diet of some sort. Maybe it's modified in a way in what it's made of or how it's prepared. But we would try to get them on an oral diet and then through exercises and strategies and so try to progress them hopefully back to a regular diet before they go home. But if not, sending them to the outpatient setting to continue that on.
And I've heard of this thing, it's called VFSS. It's another important part of what you guys do with
Yeah,
patients. What's that?
it's quite a mouthful. A video fluoroscopic swallow study. So, like I said, we really need to identify what's going on with their swallow. Not everyone's swallow is damaged or having difficulties in the same way. So we really want to identify what's going on. So what we do is we take them down to radiology and we kind of do what, so to speak, a live video x-ray. Okay. So that means we're sitting in an x-ray machine and we feed them different consistencies of foods and liquids, whether it be purees or regular crunchy items, liquids that might be as thin as water, but sometimes we have to thicken them depending on what's going on. And so with this x-ray, it's like I said, a live video. So we can watch it go down their swallowing mechanism and kind of identify, is there some weakness in certain muscles or is any of the liquid going down their airway or going down the wrong tube, like say, right? And so what can happen when that occurs is that's not our favorite. That's what we really work against happening is it's called aspiration, and that can lead to things like aspiration pneumonia. And so we really try to work to prevent that. So that swallow study really gives us a clear picture. And so then we can appropriately adapt our therapeutic intervention appropriately.
And it sounds like it's a long process working with these patients. And I bet every injury is a little bit different how long you're working with them, right?
Exactly. Yep. Some patients are here for a week, 2 weeks, but some are here for months and months. And so we really get to build great rapport with them. You're meeting not only them every day, but you're seeing their family members, their kids, their parents, whoever it may be at their bedside. And so you really get to build rapport and do a lot of education. I think Trisha can attest to this too. Family education is such a huge portion of our role. And so it's great.
Yeah, and especially like spinal cord injury patients, like what is that like the interaction with the family members like? I mean, it is such a long journey you're working with them, like the family members and the patients.
Yeah, spinal cord injury patients have the longest length of stay here at Mary Free Bed for inpatient units. They can be here anywhere from 3+ months at time, depending on their level. Their family involvement is crucial. I mean, they are a huge part of the reason they're here. Getting these family members trained, getting them to be caregivers, getting them to understand the medical complexities, their injuries, and how to care for their loved ones the rest of their lives after a spinal cord injury. So it is a huge part, especially with spinal cord injury, with all of our patients as well. But that caregiver training focus is huge with spinal cord patients.
And do your like communication goals and just overall goals with a spinal cord injury patient like change, or how do you help them achieve that in the long term?
I think communication with our spinal cord injury patients, one, there's voicing, which is a lot of that respiratory breath support training that we talked about earlier. And then two, a huge thing that we work on with communication for our spinal cord injury patients is actually utilizing assistive technology. So most of my higher level cervical patients, they don't have full function of their upper extremities, their hands, their fingers. So they're not using a cell phone like we would typically use one, or a laptop or a tablet. So then for them to communicate via text messaging, via phone calls, emails, using social media, we utilize assistive technology. And there's a lot of technology out there with, Alexa, Siri, Google, whatever it may be, where our patients can use voice commands and they can communicate with the outside world without having to use their hands. So the physical limitations will not impact their ability to communicate. And so that's a kind of a long-term thing we work on with our patients and getting them to utilize the technology, giving them access, giving them information and education, setting them up with ways to interact with their environment that's not a physical way.
And it just seems like it's a pretty unique approach that you're doing with this. Is there anything else that's like really unique or like any kind of special considerations you do when you're working with spinal cord injury patients?
Yeah, I always say spinal cord injury patients is like a whole other beast, right? In our field, they have so many other considerations than other populations. The first thing that we always consider is they have a reading scale. It's called the ASIA scale, or the American Spinal Cord Injury Association Impairment Scale. This is done by physicians pretty early on in an injury, and it gives us information about a patient's level of injury. Is it complete? Is it incomplete? What functions do they still have? And then it also gives us some prognosis and some indicators on how they will recover, like what to expect through the course of their recovery. This is kind of the first thing I consider working with my spinal cord patients is what functions do we have? What functions do we expect to get in the short time, even though it's 3 months or so at Mary Free Bed, that's a short time in their life. What can we work on? And how can I adapt my treatment to work around those limitations? So not having use of your hands or your upper extremities is often found with my spinal cord patients. So we need to adapt, right? We need voice commands. We need different things that aren't physically manipulated for them to be able to be successful. Also just being aware of the equipment that comes with being a spinal cord injury patient. I mean, they have a power wheelchair. That's their independence, that's their mobility. So be aware of that type of device, how to use it, how to help them be successful with it. Other equipment, various braces, positioning supports, pressure relief timers and systems and how that works. So there's a lot of other considerations with working spinal cord patients. I'd say those are the basics just to start with to be aware of.
I mean, in basics, it's so much. And
There's so much.
I mean,
There's a lot.
we are talking it is National Speech Language Hearing Month here, and we're talking with two of our team from Mary Free Bed. And it just sounds like a very rewarding field. The work you guys do with the patients is just incredible. Any advice you'd have for someone who's like thinking about going into speech language pathology? Maybe they're in healthcare, they're trying things out, or they want to move into this field. What would you say to them?
Yeah, absolutely. Especially in the rehab world, getting out there and observing the diverse settings. Like Trisha and I, especially your free bed, we're all lucky enough to kind of have our little niche, maybe so to speak. So that shows you how many different settings or different patient populations you can work with. So here we have spinal cord injury, stroke, brain injury, mid complex team, all the ped settings. So just getting out and understanding the diverse diagnoses and patient populations, I think you can work in is really important.
Yeah. I also think if you're interested in a career in rehab, I think, your number one thing to be aware of is your therapy has to be patient-centered goals, right? They are here to get back their independence, to get back their life, making sure that your patient is a crucial role in setting your plan of care, making your goals, and then also, like we touched on already, getting family involved. Family and caregivers have got to be involved since day one, as much as possible in their rehab journey. They're there to support them and be a team, and just being aware that, in rehabilitation as the setting, the patient isn't your only priority. Their family members, their loved ones are also going to be part of your treatment on a day-to-day basis. And so just being able to get them back to those functional goals involving the people who are important to them too is a big part of it.
Excellent. Well, Trisha and Cara, we want to thank you guys so much as we wrap up this interview. You are watching a live stream here from Mary for Bed talking about National Speech Language and Hearing Month. I just wanted to highlight some of our team and the great work that they're doing. If you have any questions or anything you want to learn about Mary Free Bed, or if you have a patient or somebody you'd like to refer to us, go to maryfreebed.com to learn more. Thank you for watching and stay well.